This is a nice sub-analysis of the ide-cel KarMMa trial, which was the pivotal Phase II trial of single-arm Phase II trial looking at BB2121 BCMA-directed CAR T-cell therapy for multiple myeloma. Now, we already know for that trial that the overall response rate was around 73%, and at the highest doses, the median PFS was about 12 months. And we know that patients who achieved a CR actually did very well with the median PFS of 20 months. So we want to understand better what predicts for complete response, because we want to send patients to this therapy if it's going to work. And so an analysis was done, a separate analysis, to try to identify baseline correlates which would potentially predict for complete response. And in this, we were able to see by a multivariate analysis that the serum BCMA as well as IgG subtype and prothrombin time, or INR, were actually negative correlates for a complete response, meaning the higher that those were, the less likely a patient was to have a complete response. And vector copy number was actually associated with a better response, a vector copy number in the drug product, which suggests a couple of things. One, that if a patient is sicker with higher tumor burden, they're probably less likely to have a complete response. So a lot of our heavily pretreated patients who have maybe exploding disease, maybe those people are not the ones that we should take to CAR T or to ide-cel in general, but we should maybe think about doing it earlier before their disease becomes too uncontrolled. That's probably reflected by the serum BCMA. And I think it also reflects that there are some people that have better expansion or drug product based on how their transduction goes and the culture process. And that's a little bit harder to determine what goes into that from the apheresis product, but that is something that is probably going to be investigated and better understood from other CAR T products. Overall, I think it's really important for us to be able to predict who's going to do well or not. This is an expensive therapy and does take a lot of patient time up front, and it can be very effective. So if we can find out how patients can do best, I think that'll be better serving the entire community.